So I guess one of the interesting challenges that we both face in our different worlds is how to cut through that noise and how to identify the data and information that's really important and impactful for decision making. So certainly with the lens that I've perhaps learned to apply is to think very critically about what it is you're trying to solve and what really is the question. And if you get the question right, then the various different tools and approaches tend to fall into place. I think the danger I see in the environment we're in now is that we get preoccupied by the tool as opposed to by the problem. How do you think about that from an NHS perspective, Andy?
I'm fully supportive. As I say, problem formulation and making sure we get to the nub of the problem is absolutely critical. We're the phrase fishing people out of rivers rather than putting a fence on the bridge is something that we hear a lot, especially when we're looking at prevention and delivery of healthcare. And again, we have this embarrassment of riches with data. We have some very, very granular detailed information, as well as primary care and beyond, and then linking these things together gives us lots of opportunities to do analysis, but it's making sure that we should be doing the analysis, not just because we can. And so I think that's one of the key bits to make sure. And then when we have that data, understanding the biases that come with it and realizing that these can be addressed, but we've got to be very, very wary. And finally, this idea of the fact that decision making is actually not just, hopefully shouldn't be just a couple of individuals. It should be systems working together, people working together. And there's that social element of making sure that we have colleagues and other system leaders working together to be able to make the best possible decisions.
Yeah, a term we use a lot actually in our consulting life is the concept of rebel thinking, which is the ability to be able to unlock as many perspectives as possible by bringing stakeholders with different lived experiences and different viewpoints together when a decision merits it. What are your thoughts on that in terms of community involvement, for example, in decisions around health?
Oh, for us, and certainly understanding value, it's key. Different communities value different interventions, different ways of accessing care completely differently. And we can't possibly think that we understand if you're an ICS leader looking after a few million people, or even in a big trust, understanding how all those different communities value care. So do they value traffic calming measures more or less in this community? Do they value being seen by the same GP, a different GP? Is it speed of access or continuity of care? What do those people really, really value? And you can't guess for them. It's getting people in the room, asking them, and better understanding that. So I'm fully on board. It takes when you're making decisions about communities and about people's healthcare, they should be involved in those decisions.